Okay, I think we are at critical mass for this afternoon, so I will go ahead and get rolling. I am Jenny Sullivan, and I am so happy you are joining us today for our summer workshop on building customized plan selection resources. This workshop is, as you probably know or are well familiar with, part of the Center on Budget and Policy Priorities Beyond the Basics project. Beyond the Basics is designed to provide training and resources to facilitate enrollment in health coverage through the health insurance marketplace and Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and other people who help other people get enrolled in health insurance. The Center on Budget is a nonprofit policy organization. We are not part of the U.S. Department on Health and Human Services, and this workshop is not intended for press purposes. Next slide. So just a few logistics today. Because we're a small group by design, this was a very hot ticket. We had a lot of interest in being in this room today, so we're so glad many of you were able to make it. But you are welcome to turn on your camera if you haven't already. It'd be great to see who we're spending time with this afternoon. But please keep your microphone muted if you're not speaking. You are welcome to unmute to ask questions or to share experiences. And certainly we'll get going with the chat in a minute here with some questions I have for you, but feel free to use the chat to share information with us, ask questions, communicate with other folks in the room, etc. If you have questions after today's workshop, you can also, of course, email us anytime at beyondthebasics@cbpp.org. And we are recording today's session, as you may have noticed when you joined the room. We're hoping that we can provide this resource for those who couldn't make it to the live sessions. So with that, I'm going to turn it over to you, Ariana.
Thank you. Okay. Thank you all so much for being here. It really is such a cool thing that we get to try out a workshop setting. I really would encourage, if you have a question or a concern, to just shout it out or type it in the chat, because we are a small group. But something I wanted to remark on, one of the challenges I just saw was someone mentioning a client asking, what plan would you choose? I remember very carefully telling a client, well, you know, everybody's different, et cetera, and I'm not really allowed to offer that kind of feedback. And he kind of took a beat and then asked, all right, if I was your sister, what plan would you tell me to choose? Clients are always going to figure out ways to ask the questions that we don't want them to ask, but hopefully this webinar will give you guys a good idea, some good ideas for building resources that will make a lot of those questions easier. So to get started, I wanted to talk about, just like at the former webinar, we were talking about building plan resources. That really is going to be the focus for us today. And the resource that I want to recommend if you're brand new, but also if you're someone who's been doing this for years and years, is the shopping tool. And every single healthcare exchange, so healthcare.gov, but also different state-based exchanges, all have a shopping tool. And I know this because, connected to a conversation Jenny and I had, I actually have bothered to go through every single state with a state-based exchange and to find the direct link to the shopping tool. So this is a resource we will provide. Obviously, once you have this link, you know, you bookmark it and you keep it. But I find this to be one of the most useful ways to compile data on your network and on individual plans prior to working with clients. And also, of course, it gives you the opportunity to look at plans outside of having a client and a client's application in front of you, which is important. It allows you to look at different types of clients and what plans are available. So this resource will be shared out. It has, of course, the link to the specific shopping tool for 2022, which is a bummer because presumably that link will change for this next open enrollment season for 2023, but I will work with Center on Budget to update the list. Some of these are straightforward. For example, New Mexico's is right on the front page of the website. It says shop and compare, but some of them, the Kentucky one, I spent a good amount of time kind of hunting down. So for some of you, this is probably pretty obvious and you use it a lot, but if not, I would highly encourage use of the shopping tool when it comes to research. So what I'm going to do is I'm going to kind of take you guys through my process when it comes to trying to figure out a network overview for a specific market. Now, generally speaking, I would be doing this for the Austin, Texas area, but connected to this this workshop, I tried to go into different areas that I'm less familiar with, which was actually very interesting. So to start us off, I'm going to use the zip code for a zip code from Miami-Dade County, which is in South Florida. If you're using healthcare.gov, which I will do for this first demonstration, you need to start by entering a zip code. I want to say across the board, this is pretty standard for the shopping tools, and it will generally, as you guys can hopefully see populated in the left-hand side of the screen, once you've entered the zip code, it'll let you know what county, and you can move forward with that. What you see, at least with healthcare.gov next, is a screen kind of offering you the option to provide more detail or to just skip ahead to full price plans. I want to highly recommend getting into the habit of having a sort of standard client, a standard way of approaching the plans so you know what to expect. By which I mean, if you're kind of playing with different ages, this in theory could change their eligibility depending on the state you're in, but also it could change the plans that you're looking at. Likewise, if you're using a lot of different income estimates, it means the plans are going to look vastly different every time you look at them. So I tend to have just a standard fake person that I use when I'm just doing research. So I would recommend not skipping the steps, but getting into the habit of giving them all the information. So having said that, ignore any questions about the former year. That is not a useful question, but make sure you provide detailed information. I tend to use 29 to ensure that I get to see all plans, specifically catastrophic plans, will not show up for a person under the age of 30, unless, of course, you're looking at full price plans, which you may do. But just as a good habit, my recommendation is 29. Gender, sex doesn't matter. And then again, making sure not to indicate any sort of eligibility that will punch you, for example, being eligible for Medicaid. So you'll notice I've selected none of these. I haven't indicated the person is pregnant. Likewise, I haven't indicated they're a tobacco user because that in theory will change the rates. Okay. You'll get a screen generally with all of these little tools connected to confirming your household, and then you'll get a question about income. Now, depending at what stage you are in tool building, what I tend to recommend is use an income above eligibility for cost sharing reductions. So if you're brand new, just as a quick reminder, people are eligible for different levels of deductible, out-of-pocket max, and different rates of copay, depending where their income is. And hopefully the little chart to the right of the income question makes sense to everybody. Basically, far left-hand column is the number of people in the household. And then as you move from left to right, it tells you what 100% of the federal poverty level is, up to 250%. Now, the reason I'm showing that 250% is for a household of one. You guys will notice I'm using 40,000. The reason I'm using 40,000 is it puts this client, and thus when I look at plans, it'll show me plans that are not showing the reduction for the cost sharing. Okay, it'll just show me basically the base plans in the silver category. If I instead use, let's say, 18,000, it would show me plans in the silver category with a much lower deductible, out-of-pocket max, and copays. So again, that information will be necessary if you start to build detailed plan overviews. But for purposes of just shopping, I recommend making sure that you understand what your income estimate is going to show you plan-wise. Okay, I'm gonna go through that quickly again. Skip this. Fill out, do it for just one person. Don't do it for a whole household. That'll cause confusion. I recommend 29. Make sure none of the eligibility indicators connected to other programs are checked, so you're sure that you're going to see marketplace plans. Confirm that. And then again, depending on what you're trying to pull up, be conscious of what your income estimate is. This will give you, of course, an estimate of what the premium tax credit is for the person, and then you should be able to look at plans. And so you guys can see on the right-hand side, I have a screenshot that basically lists out 225 plans for the Miami-Dade area of Florida, which is quite a few. Okay, so having done that, you are now looking at every single plan theoretically offered for someone in this county area. What I want to recommend is the filter key. It can provide you with so much information right off the bat. Anytime I set out to build an overview of a network, I start here. And the reason is because right off the bat, I can see a couple of things. I can see firstly that platinum plans are offered in Florida, Miami-Dade. For example, in New Mexico, which I'll show you later, they don't actually have platinum plans. In my market of Austin, Texas, we don't have platinum plans. So this is useful information when it comes to understanding what else you might need to build and what you might need to explain to clients. You can also see that there are only EPOs and HMOs in the Miami-Dade, Florida market. This is similar to what I'm used to in Austin, Texas. We do not have any PPOs or POSs. And this is very important that your assisters understand, because if you have a client who right off the bat says, I only want a PPO, you might want to have that conversation up front rather than waiting until this plan selection part to prepare them for the fact that this market actually only has EPOs and HMOs. And then finally, one of the more useful parts is I can actually pull a list just by going into that insurance company's form. And this shows me every company offering plans in the Miami-Dade County area. So the information, the information that this slide has given me is laid out in that little screen to the right. And this is a really good, healthy amount of information. When I provide right before open enrollment summaries to my team, this is often information I provide them with just so they kind of know. It would also tell you things like, is there a new company entering the marketplace for 2022, right? Because y'all are familiar with the last year. Okay. So when it comes to starting to collate this information into a form that you can use and that your different assisters can use, obviously design this however works for you and your team. We've made templates available that CPPP has, I want to say in a Google document, but they're also available as Excel sheets, and you guys are free to use these, mess with them, change them, or just not use them at all, whatever works the best. But I wanted to call your attention to a sort of design quirkiness where if you have a market with 6 companies or less, I recommend this sort of horizontal mode of writing out the company names. So in theory, you would have each company's information in columns, but for Florida, we're going to need to go vertical because they've got, I want to say 9 different companies, potentially more than that, because Blue Cross Blue Shield had 2 plan types. So rather than working from left to right and going horizontally, you would want to list your companies vertically to give yourself sort of more space to do that, to capture all the information. So just kind of keep these silly little design elements in mind. Okay, so you guys can see my fancy pants sort of version on the right-hand side. So that's what I finally put together once I have the information. I do not tend to use my fancy pants version just to collect data because Excel is, shall we say, mean-spirited sometimes. And I get too into designing it when I just need to be collecting data. So what I recommend is often just making yourself a very, very basic little spreadsheet, not a fancy one, to collect the data. And for our purposes, what I had tried to do at our last workshop was to do this live, but it was not good. So I'm trying to show you guys, this is sort of how I would be collecting data based on different plan information. So for all purposes, that working version to the left is going to translate into the fancy future version on the right, but just hopefully bear with me that it's going to look a little bit less attractive just for the moment. So the first thing I recommend gathering data on is what plan type each of these companies is offering. And I've kind of listed out some general rules connected to what an HMO, EPO, POS, and PPO is. But I'll pause here and say that these are not the greatest rules because they sometimes change. I have seen POSs that do not require a referral for a specialist. And we will see on the marketplace, there's a good number of HMOs that do not require a referral for a specialist either. So these rules are sort of changeable. This, for whatever reason, These are not real hard and fast rules, but just I wanted to give you guys this general guidance as a way of understanding the difference between the two. And to an extent, I tend to think of the HMO as similar to the similar to the POS, except that the POS theoretically offers out-of-network care. Likewise, EPO, kind of similar to the PPO, except that the EPO doesn't offer out-of-network care. So what we're going to do to get this information is we're going to go back to that filter tool. We're going to select the first company. I've listed them out alphabetically, but what you'll see as we move further into the presentation is you can list them out in a way that works for your team, as long as there's some kind of a disclaimer. I've sometimes put plans in order of the least expensive silver plan, connected to the fact that that's usually what my team is looking at first. But for our purposes here, I have it just in order of the alphabet. And so I'm going to first filter for Aetna. So what you can see now, Aetna is actually only offering 5 plans in the Miami-Dade area. And I've kind of pulled screenshots of all 5 of them, which I will acknowledge took me forever. What I can see right off the bat are a couple of important things. I can see that all the plans are HMOs. This is good. It's going to suggest that there's just one network and one plan type that Aetna is offering. And the other way I can see that, if you guys look to the right of where it says HMO, is this plan ID. Those first, and this is really annoying, don't put too much stock in plan IDs ever. But what I can see, this 92120FL008 is repeated through all of these. And then you can see that the very last number changes. What that generally means is they're relying upon the same plan design to an extent. So it tends to mean the networks are going to be the same. So this tells me that Aetna is offering one plan type. It's an HMO. And I blew that. What I should have done is, no, that's right. I'm not going to worry about including another line for connected to other plan types, because it appears to be only one plan type. Okay, so now I'm going to pull one of these Aetna plans, and I'm going to go into the plan details section. In the plan details section, again, you can see the HMO piece is listed, the plan ID is listed. And the most important part, according to me, is the plan documents section, regardless of what specific exchange you're using. Do not rely on that exchange's summary. Pull open the plan document, the summary of benefits, which is, if you pull open plan documents, generally you will get a list like this, and it's the summary of benefits that you want to pull open. And generally all the information you're going to need to build these types of summaries will appear on the first, I would say, 3 to 4 pages. You guys can see right off the bat, what I wanted to check about this Aetna plan, it's an HMO. Usually an HMO requires a primary care physician and requires a referral. You can see that Aetna is offering one of these kind of funky HMOs that does not. So to an extent, this is a detail that you want to ensure you capture, because it's a little unusual. Usually an HMO requires that referral, but this HMO does not, which means a client can pick their specialist without having to go through their primary care provider, though of course they must still stay in network. So you can see in my right-hand corner, I've indicated Aetna as an HMO, but I've made clear, despite this HMO status, that no referral is required to get to a specialist physician. This is very, very important info for people considering all of their different plan options. Okay. I'm going to the next company listed alphabetically, which is Ambetter. And I've kind of, what I would normally do is I would be looking at the full layout of all the Ambetter plans. And there's quite a few Ambetter plans. So I'm looking through a couple of things as I scroll. I'm looking to see, are all the plan types the same? They are not. You can see what this is an APO, then I have an HMO, then I have another HMO. The names are also pretty dissimilar in a way that makes me think, something's going on. And then finally, if you take a look at the plan ID, Note how different those plan IDs are. Now, this one isn't, the value and the select are not that different. There's an 05 versus an 04, probably because they were created later. But these are different, and that should kind of give you pause. So here is where I will pivot to the health insurance company to figure out what's going wrong, or excuse me, not what's going wrong, but what's afoot, as it were. And my way of kind of notating this is to list out the potential that Ambetter has actually 3 plan types on offer from the company in the Miami-Dade County. So I've listed out this EPO, I've listed out the HMO, and then I think there might be a second HMO type because I have this value versus this select. So at this point, I'm going to just Google the name of the company, the state, and 2020 plans. And I was able to actually, I've copied the link in here in case anyone's interested, but I was able actually to get a little bit more information, and it's about their 2020 plans in Florida, that they will have 3 types. They will have a EPO, an HMO, and another HMO. One is value, one is select. So this kind of confirms for me that I was on the right track here with realizing there are 3 plan types, because we want to make sure that someone signing up for Ambetter knows which plan they're picking. It can be a real problem when they assume that they're in the EPO and they're not. Okay, so now what I need to do is I need to, of course, pull open a summary of benefits from each of those 3 plan types. And y'all can see, hopefully, a couple of things. There's actually the plan ID here listed at the bottom of the summary of benefits, which can be helpful, but you can see too up here, it says plan type EPO in the summary of benefits, right? But of course, this starts with ensuring you've selected the correct plan from healthcare.gov, and then you're going into that individual plan summary of benefits. So here you can see I don't need a referral to see a specialist. That should be the case because it's an EPO. So I know what I would put in that referral piece. Now I'm going into that HMO. Again, this is the value HMO, which is different. Here I do need a referral. So that should say yes, this is a more standard HMO. And then lastly, when I go into the select, you can see I do not. So ultimately, it's going to look like this. I have 3 technically different plan types from Ambetter, and there are different rules connected to that referral piece. So this is what my data is going to pull connected to that one company. I will let you guys know, luckily this doesn't happen very often. Usually a company will offer maybe 2 plans. It's unusual to see them offer 3. And again, I do not believe all 3 of these are available throughout Florida. I think it's only in Miami-Dade County that all 3 are available. I also wanted to call attention to making sure that you use the provider directory too as a sleuthing tool. If I click open the provider directory for Ambetter, and again, usually you want to make sure that it's connected to the plan type that you're investigating. What right off the bat, the Ambetter's directory does is it has me identify my state, of course, Florida, and it is giving me different ways I can look at the directory. So obviously I don't have a member ID, or my social won't be meaningful to Ambetter. So I'm just going to do it based on home state, which I'm calling Florida. At that point, it'll ask for the county year. And now I'm seeing, county. What this is telling me is potentially that the plan offerings will differ by county. And you can see that kind of confirmed here. Florida has sort of a market for Broward, for Miami-Dade, and then for all other counties. So just kind of flicking ahead, if I in fact click on Broward, the EPO is available and the Ambetter Select HMO is available. If I click on Miami-Dade, all 3 are available. And then finally, if I click on all other counties in Florida, it is only the EPO that's available. So this is valuable information when it comes to me figuring out the counties as well. So you can see I'm indicating now that all Florida counties are with the EPO, whereas the HMO only is in Miami-Dade, and that second HMO is only in Broward and Miami-Dade. And that's pretty usual when a insurance company is sort of testing out a new type of plan. They will usually often put it in just a couple of counties. The EPO is their older plan, so that kind of checks out.
Ariana, can I interrupt you real quick with a
Yes.
question?
Yes.
There is a question from Kathleen about the marketplace, about healthcare.gov's tools to filter by network and drugs. And I just
Yes.
wondered if you wanted to comment on those.
Yes, absolutely. So what I would recommend, usually when you're, oh, I shouldn't have done this. This was a mistake. I'm going to undo what I just did. But usually as you go through healthcare.gov at the very beginning, you can add doctors, you can add hospital systems. And what I would point to is what I'm telling you connected to the summary of benefit. I am advising you guys not to rely on the healthcare.gov summary of plan info. You can, but you want to confirm it in the summary of benefits. I am going to say the same thing about providers. You can rely upon healthcare.gov's method of looking at providers as a starting out point, but for confirmation and certainty, use the specific provider directory, because there are hiccups in how healthcare.gov reads the information of a provider through another website, if that makes any sense. It's kind of a round peg, square hole situation. And so what that means is it's a tool that works sometimes. And that, to an extent, I think is a really challenging tool because you don't necessarily know what it means, right? If something shows as not in network, it might be that healthcare.gov isn't doing a great job pulling that info from the provider website, or it might mean they're not network, right? So it can be helpful as an organizing facet, but do not rely on it completely. Make sure you're confirming things through the plan and the company's individual provider directory. I'm flipping back ahead because I made a terrible mistake thinking that I could. And that's actually what I was going to show here. So here I am within Ambetter's provider directory. Note again, I've taken the steps to indicate the state, the network year, and I'm using this Ambetter Select, which is one of the three. And I searched hospital. What I'd wanted to do was find the three quote unquote biggest hospitals in the Miami-Dade area. I am doing this based on number of hospital beds. These three have the most. So if anyone were to, let's say a client were to get upset and ask, well, why did you list those hospitals and not the other? There is an answer for them. And I think this is very, very important. You guys are perfectly fine to have providers that you look up the networks for and build it into a cheat sheet, but there needs to be some kind of explanation as to why, right? We're not supposed to be promoting any one plan, and we shouldn't necessarily be promoting providers either. So make sure there's a logic to who it is you are kind of containing on your cheat sheet. But what y'all can see, hopefully, is how I've translated Jackson Memorial and Mount Sinai. Obviously, there's more information here that I'm not showing you that help me see that Baptist is not in network with any of the Ambetter plans. But again, you can sift through this data, which will take some time. And then eventually, when you distill it down into a spreadsheet like this, you will just know going forward, and it will save you so much time. For example, if you have a client who says, I must have access to Baptist, you know, right off the bat, Ambetter's not a good option for that person. And you can give them that information. If you need Baptist in network, we probably shouldn't look at Ambetter plans because they're not in network with that hospital. That's completely fine for you to say. I also wanted to add, as well, as we get into sort of figuring out the network pieces, it's sometimes a good idea to take a look at the specific provider's website, because some of them, again, not all of them, some of them do a very, very good job of indicating what insurances are accepted. I think always keep in mind, if you call a hospital or provider, the person on the phone that you're talking to probably has no idea, frankly. The thing I hear more than anything is I call a provider and I say, do you take Blue Cross Blue Shield? And if they say yes, you know you're talking to someone who doesn't know what they're talking about, right? If I tell you I drive a Honda, you know that I don't know very much about Hondas, right? How many different Honda types are there? If someone says Blue Cross Blue Shield, that is a company that offers, heaven can only imagine how many different insurances, right? And sometimes you will see a website such as, this is the Baptist Health website. And you'll notice they actually maintain resources, depending on where you're trying to go, that list out the insurances accepted. So I'm pulling one of those up. You can see I love that this hospital does this. I wish all providers did this. I know it's hard to compile, but you can see that they've even categorized the different health insurance types, which like melts my heart. I love to imagine someone doing this. And you can see right here, they have listed the health care exchange plans that they accept. So again, this can be a great starting point for those of you doing research on networks. You want to confirm it, obviously, but this is really, really, really helpful. This can, in theory, let you really break into starting out your network cheat sheets. Okay, I'm going to pause right there before we get into the plan comparison building. Any questions or comments before I bulldoze into that? An hour is not long. I always feel like an hour is long, but it's really not.
There was one thing that I'll just flag in the comments from Steve. It's more of a comment and suggestion, but interested in your thoughts on it. This is using plan data more as an outreach strategy, which I know primarily you're talking about how you have the conversation once somebody has already committed to shopping for a plan. But he has mentioned doing some digging to get a sense of the highest incomes at which people can get a zero premium plan, and using that as a way to sort of incentivize people to see that the marketplace can be affordable for them. Any thoughts or reaction to that?
I would say that's very hard because the age of the person will impact whether or not they're eligible for a free plan, right? Keeping in mind that once someone's above 400% with the newly created premium tax credits that the American Rescue Plan Act created, in theory, everyone is eligible for a tax credit. But the zero thing, you'd have to sort of backwards engineer it by age. Like you need it for every different age, because someone's income and age impacts whether they're eligible for enough PTC to make it free. In theory, it's something that you could look into, but I would also just be very wary of that type of advertising. We tried it at different points, and what happens is people see the free, but they don't see the detail. And so they come in, maybe they have a job offer and they're like, well, it said I get a free plan. Well, you're not eligible for tax credits. This says I get a free plan, right? So I've found that potentially avoiding specifics to that degree usually is going to work better for the assisters, where they sometimes have to kind of and retrain clients who saw one teeny eligibility that doesn't apply to them. So I worry that you kind of do more harm than good in the long term to say, welcome to a free plan, because there's so many other criteria that can impact it. I hope that answers that question. Okay. I'm going to bulldoze into the building a plan comparison. And I do want to kind of reiterate that I used Oklahoma. I also am going to use New Mexico. Those are much smaller markets than Florida. And here you can see, of course, that I've gone horizontal with how I've listed out the insurances, just because it gives me space in a different way. But basically, this is right now for 2022. I want to say that these are all the companies through which someone can sign up for a health insurance, well, marketplace health insurance plan in Oklahoma. I've done a little of that research legwork. Steve, I can send you this if this is useful. So what's the HMO? What's the, we have PPOs in Oklahoma's market, which is kind of exciting. We don't have those, but they don't have EPOs. So you can see that kind of where you are really can change the information. But what I wanted to call everyone's attention to is, I think the network overview is a great starting point. And if your sisters like it and use it, then potentially starting to think about building plan selection, individual plan overviews can be very helpful. So with this as your starting point, you guys can see that here I have an overview of the catastrophic plans offered in Oklahoma right now. This may not be all of them, but it's the first 5. So these are listed in order. See how I qualified that? The following plans are listed in order of the total base cost of the monthly premium. You never want to seem like you're potentially privileging something. There should always be a logic for how a tool is built. And I've listed the deductible. And then also catastrophic plans, of course, tend to have fewer benefits that are pre-deductible, what's called first dollar. So I've kind of grouped that into one column on the far right, just so in theory, someone could compare. Just seeing the deductible and out-of-pocket max doesn't necessarily tell you, well, what can I get without having to meet a deductible? And that, I think, is the value of building this for the catastrophic plan types. And also potentially for the bronze plan types. Quickly, what I wanted to call your attention to is the fact that the colors on my network cheat sheet match the colors here, right? You can see the Friday plans are one color, the bright plans are one color, etc. And the logic of that is kind of attaching the information from that overview to the individual plan. So you're sort of referring back to it, right? Like, let's say the person needs an HMO, which I've never heard of such a thing, but you would know to kind of consider the Friday option and the United option, though of course there's no United option listed. Just to quickly give you guys how I do this, I will acknowledge this is time consuming, but I will also say this, if you can get this done, it is well worth it. It will take up a lot of your time during the critical week right before open enrollment begins, but it will save you all the time, all through the rest of open enrollment. And in fact, throughout the remainder of 2023, because it will continue to be relevant. So I, again, am going to go into my tool. This time, of course, I have filled this out to put me as a 29-year-old in Oklahoma. I want to say I use Cleveland County, a zip code there. And I'm going to start by pulling catastrophic plans. So once I do that, right, I'll have a list, which I can translate into my spreadsheet. But I want to, again, go into that plan details section. And from the plan details section, yes, there's the healthcare.gov summary, but your best bet, get into the plan documents, get into that summary of benefits. And from there, you guys can see that I've kind of pulled out the information that's relevant. Pivoting ahead to bronze, you'll notice my format for bronze is different than catastrophic because there tend to be a little bit more first dollar care, meaning items that are covered without having to meet the deductible. So the 3 least expensive bronze plans in the Oklahoma market are with Friday. And this is one of those situations where someone's like, well, there are 3 freaking markets, 3 plans with Friday. One is called Basic Plus and one is called Plus Copay, but I can't really see all that much in terms of the difference. For example, sometimes the way this information is sort of how it appears and how it appears to be compared on healthcare.gov can be a little iffy. So this can really kind of help you. And especially since normally you'd have more than 3 listed out, it can really help a client understand what the distinctions are in a real-time, holistic way. So I think if you are going to undertake this, bronze and catastrophic are really good ways to start because of the fact that the benefits are sometimes kind of concealed. They're sometimes a little bit harder for a client to understand because the deductible is so high. They may not understand that, hey, there is value in this plan. And I think this is a resource that can call their attention to it. If you do get into the silver, something you need to be aware of is, of course, you can see that my format for the silver plans is way more detailed. So I have deductible, out-of-pocket max, primary specialist tests, which of course means labs and or blood work, x-rays, and theoretically imaging I include in the test category, though technically let's not get into it. First tier meds, second tier meds, urgent care ER room. So I don't include all of that in the bronze just because it doesn't come up very frequently. But once you start getting into the silver plans, there are many more plans that tend to offer some of these benefits in a first dollar way. But what I really want to make sure I call your attention to is this first sheet you're seeing is for my 29-year-old at $40,000. That means they're looking at no cost sharing. If you are going to build this, you have to build 3 more versions of this that show cost sharing at 94%, 87%, and 73%. Okay. That can be a lot. What I will say is after you build the no cost sharing one, the others are a lot easier because you just copy and paste your original sheet and then you just kind of update the information line by line. It is boring. You will get bored doing it, but this is such a good activity for assisters during that first week if they have downtime, or even the first week that plans are released at the end of October. It will teach them so much about the plans. And I want to show you, so as I move from this no cost sharing spreadsheet, what I would have needed to do instead to look at somebody with, excuse me, not 94, but 87%. So somebody between 150 to 200% we'll be looking at totally different values than somebody at 40,000. So what I did was I used 20,000 instead of 40 as my estimate. Ignore what it says down here. That should say 87, not 94. And then what you guys can see, the top group is my no cost sharing. The bottom group is my 87%. So you can see that, for example, the deductible on that same Friday plan, right, was $5,500. If I'm at $20,000 instead of 40, my deductible is 1,000. So you would need to do 4 of these, which is not unpainful, but it will also teach your team so much when it comes to understanding cost sharing. It will really, really help them see how those subsidies kind of work for clients and what the value of them are. Okay, so I wanted to use a state-based exchange just to demonstrate that even though my expertise is completely from healthcare.gov, this is exceedingly doable in state-based exchanges. Most of the shopping tools in other states operate along the same line. Sometimes they're a little bit more complicated or tricky or hidden, but I'm going to use New Mexico's. I did a little bit of the initial labor connected to mapping out what the network is. We have Molina, Ambetter, Friday, Blue Cross Blue Shield, True, and Presbyterian Health are the companies offered in New Mexico. They're all HMOs, but weirdly enough, not a single of them requires a referral. That's huge. And that's probably the case because the companies had to stay competitive with each other. A really nice benefit. Also, a nice piece of this is that every single one of these companies, as far as I can see, don't quote me on this, but as far as I can see currently, all appear in every single county of New Mexico. So again, in theory, you might change how you orient this information based on the fact that there's a lot more consistency with it. Maybe you cut that HMO over referral thing as they're all the same. Maybe you make that one line of information instead of 6, but again, that's up to y'all. So here is the New Mexico shopping portal. It's called Be Well NM. The preview is right there. You want to get started. You want to fill out your zip code. It tells you the county. Coverage start date, of course, is a little confusing and different because generally a client can't necessarily pick that, right? Depending on what type of insurance they're signing up for, et cetera. But just go with what's listed for purposes of looking up information. Again, if you say no to this question about costs, it won't show you premium tax credits. I say get out of the habit of doing that. You want to see the plans with financial assistance, so say yes. Little bit more work required from you in New Mexico. They want you to name the member for whatever reason, and they want you to say the total number of people in your household. Like I said earlier, go with 1. It keeps it simple for the purposes of research. I named my fake person Boutros Ghali, the former UN secretary, because I love that name. And I said he's 29. He is not 29. That's inaccurate. Again, a couple of questions connected to eligibility. You want to answer this in such a way that you are not going to make the person eligible for Medicaid, right? And this is more likely to happen in a state like New Mexico that has expanded Medicaid. So make sure you're answering questions in such a way that it will show you healthcare.gov plans. And again, the type of plans you want to see. So you want to get practiced at this if you are using the shopping tool, because you'll go through it a lot. So get used to a good, straightforward way that works for you. All right, again, my same shtick, I say use 40. It puts you above, for a household of 1, 40 puts you above 250% FPL, which means that you are looking at plans, silver plans without cost sharing. Again, here's that little chart. This chart, by the way, is something I made for my organization. It's bigger usually. It usually goes up to 400% and then has some detail about the American Rescue Plan. If you would like that chart, if it would be helpful for you, please email me or email Center on Budget. There are tons of these charts everywhere, I'm sure, but the one with the breakdown of cost sharing is really useful to my team. So if that would be of use for you, please let me know, and I will update it for 2023 eventually. Okay, so you get to kind of a long page that tells you the eligibility, just like healthcare.gov. The challenge here is you really have to kind of scroll and look for the big colorful button that will take you to plans. But if you scroll all the way down, you will find it. New Mexico's marketplace exchange, whatever it's called, Be Well, it's called Be Well, lets you pick if you want to look at health or dental, which is nice. I'm going to tell you, generally speaking, I try very hard not to help clients shop for dental, which I'll try and talk about a little bit later on. So I just picked health here. I tend to not trust the exchanges shopping tool. I want to look at the plans. I want to get the information. So I will skip right away to that preview plans. And then from there, we're in the plans. Now, what you can probably see immediately is the shopping tool is set up a little bit different than the healthcare.gov one. The filter is on the left, which threw me. And of course, the plans are laid out just a little bit differently, but it is all kind of to an extent there. The information that appears on healthcare.gov appears here and appears so far on every state-based exchange I've seen. So there's no reason that anyone should be unable to do this connected to their individual exchange. You can see left-hand side, I have the list of the 6 companies, not in alphabetical order for whatever reason, but hey, that's fine. And then you can see too the coverage level. So you'll note New Mexico has no platinum plans, but they have this interesting extended bronze category. I don't know what that is. It sounds like a bronze plus, but that would have to, in theory, be its own spreadsheet of plans, right? They also don't seem to have catastrophic plans as well, but this is all interesting information to kind of complete connected to New Mexico. So I'm going to pull open the least expensive least expensive silver plan generally, just to kind of eyeball what's going on. So this is the top of the page. The bottom of the page, again, is where you want to scroll to find plan documents. There's obviously a ton of summary that the exchange does for you. Don't trust it. Get used to reading all kinds of summary of benefits to capture information, because it is honestly the best way to ensure accuracy. So once you pull open plan documents, it'll actually give you the PDF, which is right there. Click on that. And then you can, I'm filling out my fancy one now. You can see that my silver version is a little bit more detailed. What you can also see on the bottom is I have one for the 05, I have one for the 04. If you do a silver one, you probably are going to need to do the other 3 silver versions. So to start, here's my summary of benefits. I need to obviously put the plan name. I add the ID number just for the sake of reference. And I also link the summary of benefits to that first box, so that someone can pull it open and double check my work. Again, time consuming in the short term, amazingly helpful in the long term. But what you can see is I have a $0 deductible, and I have a am I reading this right? Yeah, $13.50 no, that's the drug deductible, $85.50 out of pocket max. So here it is. I've updated it. Notice I've added that drug deductible piece. That's a little bit unusual. I found that more and more marketplace plans are not having a separate drug or other separate type of drug deductible, but it does happen. So include that information so your sister is aware of it, because again, the only thing that appears on the exchange screen is the $0 deductible, which when it comes to medications is not quite accurate. All right, so moving forward, I'm now at page 2 of the summary of benefits. You can see here's the primary care visit, $30 copay, specialist visits. And I'm gonna go ahead and add that right there. Then I have my tests. Again, I use test as a blanket term. If you or your sisters don't like it, change it, because I call imaging and diagnostic a test. But is imaging a test? Yes, it's a test. It's a whole thing. But you can see listed out there, there's a $50 copay for blood work, $135 copay for x-rays, and $700 copay for imaging. So there it is in my little cheat sheet. And then generic drugs is going to be my tier 1, whatever is listed as their first medication, put that in the tier 1. And then if there's a copay for tier 2, you can see that that'll show up right there. Urgent care, I want to say it's usually on page 3 or 4, depending, but it's going to appear in that immediate medical attention section of the summary of benefits. And you can see there's a $30 copay, and there's also a $1,400 copay for ER care. This is very unusual. Obviously, the only reason this is the case with this plan is because it has a $0 deductible, that there are copays for so many services. You guys may remember from my Oklahoma sheet that there are holes in it, and the hole in it, as communicated right here, just says that the care category is covered only after the deductible is met with a coinsurance. So where you're paying a percentage of the cost, whatever that may be. So this is intended to capture those first dollar benefits. Okay. So when you first do this, it'll take forever, but I promise it speeds up. And it's definitely something in terms of putting together network overviews and plan overviews. It's something I want to work with Center on Budget to see what we can help with. So, give this a shot. It can be simple. Don't try and design something that, takes more time than gathering the actual information. Make it as simple, as useful as it can be. And again, I recommend starting with that network cheat sheet and then potentially building into looking at the bronze or catastrophic plans and indicating which plans have some kind of first dollar care. So people looking at those options know that there's value in them, and you have an easy resource for your assisters and yourself to rely on. I have kind of an overview, some tips and cheats connected to that, the whole task of building plan comparisons. It really does benefit. I assign different members of my team. Okay, you're going to do 06 silver in this county. You're going to do the 05 silver in this county. And then I have one person collating the data, right? So people will mess this up. I'll be honest about it. They'll read something the wrong way. So having many sets of eyes looking at it, confirming it, is really a good way to go. And it means that your team is sort of building something holistically that you all can rely on. It really, really will make a world of difference. My email is up there. You can feel free to email me directly, but you can, of course, email Center on Budget as well. Anything you want here, we can certainly make available. This is recorded, I believe. So it's going to be sent, the recording. Oh no, I forgot about that. And then finally, I want to say one thing about dental, which is I highly recommend letting clients know that dental is completely different than the healthcare benefits that the Affordable Care Act has sort of guaranteed them. Dental is so specific that unless you know the specific tooth, whether it's a bicuspid or a other tooth, and what material you need for a filling, you may not be able to successfully pick a plan that'll cover that. But the genius here is you can pick a dental plan outside of the exchange all year based on need, right? The downfall of medical insurance is I can't wait till I have a heart attack and then pick a plan where the trauma ones, right? I have to pick something and work with it, right? But that's why the ACA has created the benefits it has. Dental insurance is not like that. You can pick it based on what you need. You can buy it all year, not through the exchange. Make sure they know that, they'll get mad. But there are plenty of websites where somebody can truly shop for a dental plan. As much as possible, I would disconnect the notion of dental being like medical health insurance, because they're completely different beasts. And the work assisters have to do explaining and educating clients on health insurance and what those benefits are. And then you want a dental plan? It's a different conversation, and it should be a different conversation. And if you have questions about how to nudge clients in that direction, it's something I've spent a lot of time helping assisters explain. So feel free to hit me up. I think we're at time. I want to pull up the upcoming webinars that Center on Budget Beyond the Basics is offering. maybe I should stop talking and let Jennifer talk. Hey.
No worries. Thanks so much, Ariana. You've kept the audience all the way to the end, so I think that's telling. Thank you all for joining us. I think you have our contact information so you can follow up with any questions you might have or suggestions or feedback, since this is the first time we've done a different sort of session like this. Just a reminder that registration is open for our fall open enrollment series. You've got all the topics and the dates there. Of course, those are on our website along with the registration links, and a special plug for the webinar we're holding on October 20th, which will be in Spanish. This is the first time we're doing something like this. The recording and the slides and all the information from today will be circulated soon. There is a version on our website from the workshop that we held on Tuesday, but we're going to update that. So you can go there and it won't look just like the presentation you saw today, but we'll get you the updated information in a few days. But thank you so much all for joining us. And with that, I am going to close us out for today. Thanks so much, Ariana.